The first few minutes after waking can tell you more about your body than you might think. You swing your legs over the side of the bed, stand up, and suddenly your knees feel tight. Your back feels slow to straighten. Your fingers do not close around the coffee mug as easily as they did the night before. For a moment, it can feel as if your body has aged overnight. Many people over 60 hear the same explanation. That's just getting older. But that answer is too easy. Morning joint stiffness is common, but it is not something to dismiss automatically. Sometimes it is a normal response to hours of lying still. Sometimes it may be linked to osteoarthritis. And sometimes, especially when it lasts longer or comes with swelling, warmth, or fatigue, it may be a sign that inflammation or another health issue deserves attention. So the real question is not simply, why am I stiff in the morning? The better question is, what kind of stiffness is this? How long does it last? And has the pattern changed? Because after 60, patterns matter. A little stiffness that eases after a few minutes is very different from stiffness that lasts an hour. A knee that feels tight after years of arthritis is different from both hands suddenly feeling swollen and painful. A body that loosens with gentle movement is sending a different message than a body that becomes more painful, weaker, or harder to use. This is where many people get confused. They assume morning stiffness means one of two things. Either it is nothing, or it is something frightening. In reality, it is often somewhere in between. It is a body signal, not a diagnosis, not a reason to panic, but a reason to pay attention. One common reason joints feel worse in the morning is simple stillness. During the night, your joints are not moving much. The muscles around them are quiet. The tissues are not being stretched. The fluid inside and around the joint is not moving the way it does when you are walking, bending, reaching, or gripping. Then morning comes, and your body suddenly has to move again. That first movement can feel tight, heavy, or resistant. Many people describe it as feeling rusty. The first few steps are slow. The hands feel stiff. The back may need time before it fully straightens. For some people, this improves once they begin moving. The joints warm up. The muscles begin to support the body. The stiffness fades into the background. That kind of pattern is often seen with osteoarthritis, which becomes more common with age. Osteoarthritis can affect the knees, hips, hands, spine, neck, and lower back. It involves changes in the cartilage, bone, and other tissues inside the joint. Over time, the joint may not glide as smoothly as it once did. But osteoarthritis is not just old age. And it is not just a worn-out hinge. It can involve irritation, stiffness, tenderness, and changes in how the whole joint works. That is why a person may feel fairly normal in the evening, then wake up the next morning feeling stiff again. The joint has been still for hours, and it needs time to get moving. But duration is important. If stiffness lasts only a few minutes, or improves fairly quickly once you begin moving, that may fit with overnight inactivity or osteoarthritis. But if morning stiffness lasts longer than 30 to 60 minutes, especially if it happens often, it is worth asking a doctor about. Longer-lasting stiffness can sometimes be related to inflammatory arthritis. With inflammatory conditions, the immune system and inflammation play a larger role. The joints may feel swollen, warm, tender, or painful. The stiffness may be strongest in the morning and may not loosen quickly. Rheumatoid arthritis, for example, can sometimes cause stiffness in the hands, wrists, or feet, often on both sides of the body. Some people also notice fatigue or a general feeling of being unwell. This does not mean that morning stiffness means rheumatoid arthritis. It does not. But if the pattern fits, it should not be ignored. There is another condition older adults should be aware of: polymyalgia rheumatica. It is more common later in life and can cause aching and stiffness around the shoulders, neck, hips, or upper thighs, often worse in the morning. If someone over 60 suddenly has trouble raising their arms, getting dressed, or rising from a chair because of morning stiffness and aching, that is a reason to seek medical evaluation. Again, the goal is not fear. The goal is recognition. Morning stiffness can also be influenced by the rest of your health. For example, Blood sugar and metabolic health can sometimes affect the joints and connective tissues. Some people with long-standing diabetes develop stiffness or limited movement, especially in the hands. The fingers may feel tight, and the hand may not open or close as easily. Sleep also matters. Poor sleep can make pain feel stronger the next day, and pain can disturb sleep, creating a cycle where the body feels more sensitive in the morning. Daily movement matters too. A person who sits for long periods may feel stiffer not only after sleep, but after watching television, driving, or sitting at a desk. The body often becomes more resistant after long periods without motion. This is one reason complete rest is not always helpful. Of course, rest is important when there is injury, severe pain, or a medical condition that requires it. But for many older adults, too much stillness can make stiffness worse. Medication can also enter the conversation. Some people notice muscle or joint discomfort while taking certain medicines, but this is very important. Never stop a medication on your own because of stiffness or aches. Some medications are protecting your heart, blood pressure, blood sugar, or other serious health needs. If you suspect a medication may be connected to new pain or stiffness, bring it to your doctor or pharmacist and ask for a safe review. The same caution applies to supplements. Joint supplements are heavily marketed to older adults. Some promise smoother movement, less inflammation, or even joint repair. But natural does not automatically mean safe. Supplements can interact with blood thinners, diabetes medications, heart medications, blood pressure medications, and other prescriptions, so before adding a supplement for joint stiffness, especially if you take regular medication, it is wise to ask a qualified healthcare provider. Now, let's make this practical. If you wake up stiff, start by noticing the pattern. How long does it last? Which joints are involved? Does gentle movement help? Is there swelling, warmth, redness, or tenderness? Is this something you have felt for years? Or is it new? Is it getting worse? Is it affecting your ability to walk, grip, dress, climb stairs, or get out of bed safely? These details are often more useful than simply saying, "My joints hurt." A doctor can do much more with a clear pattern. Morning stiffness for 10 minutes in one knee is different from stiffness for an hour in both hands. Stiffness that improves with movement is different from stiffness that comes with swelling and fatigue. A long-standing pattern is different from a sudden change. For everyday support, gentle movement is often a reasonable place to begin, as long as it is safe for you. That does not mean forcing painful joints. It does not mean pushing through severe pain. It means giving the body a gradual start. Before standing, you might gently move your ankles, bend and straighten your knees, open and close your hands, or roll your shoulders slowly. The goal is not exercise performance. The goal is to help the body transition from stillness to movement. During the day, regular low-impact activity may help many people with arthritis or stiffness. Walking, stretching, water exercise, cycling, or guided physical therapy can support strength and mobility. The right choice depends on your balance, pain level, heart health, joint condition, and medical history. Movement should be safe, realistic, and consistent. Avoiding long sitting periods can also help. If your joints stiffen after sitting, that is a clue. Your body may respond better to short, gentle movement breaks during the day. Nutrition can support overall joint and muscle health, but it should not be turned into a miracle claim. A balanced diet with enough protein, fruits, vegetables, fiber, and healthy fats can support the body as a whole. But no single food cures morning stiffness. Hydration also supports general body function. It will not fix every joint problem, but being dehydrated can make the body feel worse overall, and sleep deserves attention. If pain wakes you up, or if poor sleep makes mornings harder, that is worth discussing with a healthcare provider. Pain and sleep often affect each other more than people realize. There are times when morning stiffness should be evaluated sooner rather than later. If it is sudden and severe, do not brush it off. If a joint is red, hot, swollen, or very painful, get medical advice. If stiffness lasts more than 30 to 60 minutes most mornings, especially with swelling or fatigue, it is worth discussing. If you have fever, unexplained weight loss, unusual tiredness, or a general feeling that something is wrong, do not ignore it. And if stiffness is increasing your risk of falling, making it hard to walk, or interfering with basic daily tasks, that is not just a nuisance. That affects independence and safety. Morning stiffness after 60 is not always dangerous, but it is also not meaningless. Sometimes your body is saying, I have been still too long. Sometimes it is saying, this joint needs support. Sometimes it is saying, inflammation may be part of the picture, and sometimes it is saying, this pattern has changed, and it is time to ask for help. The main lesson is simple. Do not judge stiffness only by how it feels in the first moment after waking. Judge it by the pattern. How long does it last? Does it improve? Is there swelling? Is it new? Is it spreading? Is it limiting your life? Those answers matter. After 60, the body often speaks in small signals before it speaks loudly. Morning stiffness may be one of those signals. Not a reason to panic. Not something to self-diagnose, but something worth understanding. So the next time you wake up and your joints feel slow, tight, or resistant, do not simply say, I am just getting old. A better response is, let me pay attention to what my body is telling me, because understanding the signal is the first step toward asking better questions, making safer choices, and protecting the movement that helps you stay independent. If you want more calm, clear explanations about the body signals that can appear after 60, subscribe to the channel and keep learning how to read your health with more confidence.